I am Dr. Kulin Kothari, an ophthalmologist and eye surgeon from Mumbai and managing trustee of Vision Foundation of India. Vision Foundation of India was established in 1993 with the primary objective of reducing blindness in India, especially from the lower socio-economic strata of the society. Vision Foundation of India is a not-for-profit, non-governmental organization, and it is working all throughout the country in more than 20 states. There are various projects which are going on undertaken by Vision Foundation of India, and the flagship project is what we call as Rashtriya Netra Yagna, where we intend to do 1.1 million or 11 lakhs free eye surgeries for below poverty line people across the country. And this project we started from 1st April 2015, and by now we have done more than 300,000 or 3 lakhs free surgeries for these people. The other project what we have undertaken and will be starting within 15 days time from say about 1st of September 2018 is a national diabetic retinopathy project, what we have named as Project Sugar and Sight. Under this project we will be screening 2.5 million people or 25 lakhs people across the country, again by doing various camps, and this will be below the poverty line people. We will start with doing a random blood sugar testing, so we know whether diabetes is there or no in that particular person, and if it is positive or if there is history of diabetes, then we will take the retinal image by a specialized digital retinal camera. These images which will come to us by telemedicine, and our eye surgeons will read these images to diagnose and to decide whether this eye requires any further treatment, either in the form of laser or in the form of injection or in the form of any surgery. And this, if required, will be done at a pre-selected centers close to their villages or towns, and again this will be done totally free of charge for these below poverty line people. The whole funding and the whole cost will be borne by our foundation, that is Vision Foundation of India. One other project which we are doing right now, it is named as MUSE or Mumbai Urban Slum Eye Care, where we have started a few slum centers in Mumbai. As you may be aware that about 60% of population in city of Mumbai is in slums, and they may not have facilities for their eye care, and our doctors, they go there periodically and see them periodically, and whatever treatment is required are brought to our Apex center at Babulnath for the treatment. One other ambitious project which we are in discussion with the government of Maharashtra is how to reduce blindness in the state of Maharashtra, and I am very happy to share that our Honorable Chief Minister is interested in this project personally, and we are talking to his health advisors that how do we reduce the blindness in Maharashtra, and how can we adopt villages, how can we adopt districts, and how can we go to a grassroots level with the help of say team of ASA and go door to door to screen these people, and then if required they are referred to vision technician, and if further required they are referred to the base center for any line of treatment. So these are a few of the projects what we have been doing or we want to start soon, and there are quite a few projects in pipeline. Say for example, we will be starting a project of rehabilitating visually handicapped people who cannot be helped either medically or surgically, and they are so much visually handicapped that they cannot live a normal life. So how do we value add to them, how do we enhance their skills to make them employable so that they are financially and economically self-sufficient. This is one project in the pipeline. So thus the objective of Vision Foundation of India is to reduce blindness in our country, to avoidable blindness in our country, and also to help and rehabilitate people who cannot be helped. Eye surgeon in city of Mumbai, and I am practicing since about 38 years. In 1992, we started a different concept, or probably for the first time in the city and one of the first times in the country, of multiple specialty eye doctors working together for the benefit of the patient. So, in our institute, we have specialized eye surgeons like retina specialists, glaucoma specialists, pediatric ophthalmologists, oculoplastic surgeons, etc., etc. This concept was first, as I said, started in 1992, and today we have a team of more than 25 eye doctors. But more important than that, we are one of the few centers in this city or in the country where we cater to all the socio-economic strata of the society. Say for example, we have paying class, below which we have an economic class, below which we have a highly subsidized class, and below which we have a free class. And the objective or the concept behind this is no person has to go back from our institution just for the want of money. And in highly subsidized class, the amount charged are so token that anybody by and large can afford. Say for example, a new patient coming in this class, we charge only 100 Indian rupees, and the follow-up is only 30 Indian rupees. And the surgeries are also done according at a very subsidized cost. I feel very proud to start this kind of center which is helpful to the society. And one or two other things I must mention, that all the team doctors are supposed to do only scientific work, only ethical work, and only whatever is best for the patient, and nobody has to think about the revenue part of the institute. So that doctors, they focus on their work, and there is never any commercial angle of treating any class of patient. I am also fortunate and honored to have my son Dr. Saumil in our team, who is expert surgeon, and his wife Dr. Sonia, also an expert surgeon and a cornea specialist, because of whom I can focus more time on the charitable part of our projects, which is undertaken through Vision Foundation of India, which is a not-for-profit, non-governmental organization, and which has been doing a lot of charitable projects throughout the country.